Excited to have Dr. Licata back on the podcast now for the third time. I think it's the first guest to be on three times. I appreciate you taking the time today to talk a little bit about annual physicals. Give us a little kind of a overview of what your practice looks like today, kind of what your daily or weekly routine looks like, and kind of what are you doing for the patients here in Coleman?
Yeah, so thank you so much for having me back. I'm excited to be asked back for, like you said, a third time. So our Coleman Regional Pediatric Clinic is up and running. We've now been open for a year and a half, and we are seeing well child checkups during the day and as well as same day sick visits. But also, Dr. Dodd, Dr. Jones, and myself are a part of the pediatric hospitalist group. And so occasionally we are on call for the inpatient pediatric patients as well. And we also perform circumcisions in the newborn nursery. So quite a varied job that we do on a day to day basis.
Yeah, and so with annual checkups and bringing their children in, it's often for parents they think that the early stages of the child's life is really important, but it tends to kind of fall off. Why do you kind of see that as being the case? And maybe what are some things that you're doing in the early stages of the child's life versus kind of in that later stage, that later elementary going into middle school?
Yeah, so I think a couple of reasons probably come to mind. One being that the appointments are scheduled much closer together early in life. And so they're perhaps closer on the parent's mind, needing to come back to the doctor, seeing it on their calendar, and making sure to make those follow up appointments. As you get a little bit older, you don't necessarily need a checkup but once a year. And so sometimes that gets forgotten. Also, I think luckily, once a child learns to walk, once a child learns to talk, and once they learn to get along with others, they usually do pretty well in school and pretty well in life. And so there aren't a lot of health challenges that really hit in the early childhood years. And so maybe a parent doesn't feel the need to see the doctor each year after.
Yeah, and so post kind of having those vaccines and anything that the child needs, what are you looking for in that child in those annual checkups, and kind of what's the importance that you see as the physician, kind of to have that child coming in on a regular basis to kind of see them develop and grow, and what are you looking for, and what can you maybe spot?
Yeah. So there are a few big categories that are involved in each well child check, even as an infant, toddler, and an older child. So that would include growth and development. So there can be growth changes in the school age that either caused by celiac disease or thyroid disorders that are a little bit different than what you see for the infant or the toddler. There are also routine screenings, including vision and health, where we can catch poor vision or deficits in hearing. I'm sorry. And then finally, we also start to do emotional and mental health screening. And so I think having those conversations with older children is much different than, of course, the infant and toddler age range. So those are a couple of the things that we're looking for at those visits.
Yeah, and oftentimes maybe the parents are looking at their classmates of their kids to kind of see how they're progressing at each stage of their life, especially if these are kids that their kids are growing up with
That's right.
too. What are maybe the importance for them to still come in, and like there's often those things that you maybe are checking when they're getting the vaccines early, but they maybe not show up until later, and that importance of continuing those development, because every child kind of develops at a different stages or at a different rate than maybe
Yeah.
their classmates do.
Yeah. Definitely. So I think with a couple of things, one being vision or hearing or ADHD or autism, a couple of these things that you might not notice it in a classroom of multiple children, but if you can really tease it out and do the test and do the screen, some things come up that maybe even the child or the parent might not be aware of. And then yes, there are averages, and there are definitely um, most children developing at a normal rate. But even when it comes to something like puberty, you can definitely have late bloomers, early bloomers, changes happening at all different times. And so, just to make sure that your child is on track, it's important that they see their doctor at least once a year.
Yeah, and I feel like there's a lot of things that maybe their teachers are looking for, but they do have so many other kids as well, and so they're trying to give feedback to the parents at a rate that they can, but they're dealing with everything else too, with keeping the child in class and
Yep.
all the things that are along with that.
Yep.
If a parent's listening and they've maybe had a drop off, they haven't maybe prioritized those annual visits as much as they want. Is it too late? Can they jump back into it?
Yep.
Is it too far gone, and and then maybe annual visits aren't really a thing they should worry about?
Yep. So I guess let me say it's never too late to get back on track. Um, us as pediatricians, we're always happy to see the kids back in the office. And it can be important. Perhaps questions have sort of built up, and the parent and the child are needing a space or a time to sort of get those questions addressed. Please call us. Please schedule that annual checkup. Please ask all the questions that you have. Really getting back on track and allowing the doctor to sort of re-engage with the family and get to know you on a closer basis can really help for the care of the child and also the rapport and the relationship with the doctor and family as well.
Yeah, and because there's probably things that maybe the child will be more comfortable telling you that they weren't comfortable telling maybe their teacher or telling their parent, because in that environment, it just doesn't seem like they wanna maybe stick out or look different,
Yeah.
but to you, it's a safe environment, and they can say something like that. With this episode coming out in the summer, and summer months sometimes lead to more flexibility for the parents and students and everything involved. There's less things going on. Is now a good time and to kind of get started with those annual visits? And maybe even if there is follow-up visits or specialists,
Yeah.
is now a good time to be involved with that and get started?
Yeah, I would say summertime is a great time to get back in with your doctor. As the doctor's office sort of comes out of respiratory season, we have fewer and fewer sick visits. And so there is often more availability for those annual checkups. So I would recommend summertime as one, a time where you could either implement the lifestyle changes that we can discuss and the healthy habits that often come up during checkups. But also, as you mentioned, the specialist visits, the referrals, any x rays or labs or follow ups that need to be done, and also kind of like a testing period when the child's not in school. Maybe they're not participating in all of their extracurriculars. You can really evaluate the child spending more time at home. We can watch their health and also watch their behavior if there are any things going on.
Yeah, and I feel like the timeliness of this episode, with this episode coming out in the summer, if you're listening and the annual visits is something that you've been kind of pushing off, and now you think is the right
Yeah.
appropriate time, we'll be sure to have everything in the episode notes, with information, with numbers, with to contact Dr. Licata's office and get that appointment scheduled. But I appreciate you taking the time to come back on the podcast for the third time and share a little bit about something that I think is really important and is timely for parents that are listening.
Great. Thank you very much. We'll be happy to see your patients and your parents at Coleman Regional Pediatric Clinic.